Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Hi, I'm Dillon Powell. I'm a medical student at Columbia and the first author on this paper. I'm joined today by Dr. Babak Azizzadeh, and can introduce the topic of synkinesis and why we got interested in this topic in the first place.
So, synkinesis is still probably one of the least understood issues relating to post-facial paralysis outcomes. And, our clinical experience with synkinesis is complicated. Obviously, a lot of the issues that we're dealing with are smile dysfunction or issues related to simultaneous contraction of the eyes and smile and face. But one of the most critical and quality of life issues is related to the platysma, the contractions, the hyperactivity of muscles. And in my clinical experience, I had noticed that many of our patients had really reported neck pain and discomfort that would get better with Botox or some of the surgical procedures like the modified selective neurectomy that we've published on extensively in PRS and Facial Plastics and Surgery and Aesthetic Medicine Journal. And so that was kind of the premise of why we wanted to really start studying and evaluating this a little bit further, a little bit more scientifically. So Dillon was a phenomenal medical student who we ended up doing this paper with. So Dillon, maybe you could share a little bit about kind of the study and some of our findings.
Absolutely. Thank you. So we used a survey-based assessment, and we had a combination of the Synkinesis assessment questionnaire and the neck disability index. And so we were measuring in two different population groups, both in synkinesis patients and in normal healthy subjects, and seeing what was the level of neck pain and then what was the level of synkinesis. And our findings were fairly straightforward in that patients who had synkinesis tended to have worse neck pain than the average person as measured subjectively by these scales. We also saw that with increasing levels of synkinesis, so patients that had more severe disease, there was a weak correlation with worsening neck pain. So that is, patients who had kind of worsening synkinesis, that their neck pain was worse. So our plan is to kind of continue this going forward and see some of those treatments Dr. Azizzadeh talked about, the Botox, the modified selective neurectomy, that does that treatment actually objectively change how neck pain is viewed by patients before and after? And so that's kind of the plan going forward.
Yeah, and I think this will potentially can give us more insight into how and which methods we can use to improve people's quality of life, because chronic neck pain is a major issue. It's one of the biggest factors for disability, in a sense, for many individuals. So if we can find ways of improving that for our patients with synkinesis and really giving them better knowledge about it, I think this will be a great addition to our knowledge and treatment protocols.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.